Dr. Leigh, what's the story about, silver fillings or amalgam fillings, as they're called, versus the, white fillings, the ceramic fillings? I don't know what the name is. For quite a bunch of years now, a decade kind of, like, there's all kinds of hula hoop about it. What is it about it? Was it all a false alarm? Is there some truth to it? What's your take on it? Not what the association takes it. Dental Association take on it is. What is your take on it?
Well, I personally like the composite or the white fillings better because we have to, when we're preparing a tooth for a filling or a crown or an onlay, we don't have to cut away as much tooth. I mean, that's plain and simple. It's more conservative preparation of the tooth, less grinding of teeth than if we were doing a silver or a metallic type of restoration. It's easier to work with. It's lifelike. If we can control the shape of the tooth, it's going to function better. So there's a whole host of reasons why we like ceramics and composite resins. And sometimes we have to use gold, but for the most part these days we can use ceramic and composite resin materials that will look and function and.
Okay, well, let's go to you said there's a whole host of reasons, and you mentioned a bunch of them. They have to do with with the workability, the less grinding. I get that. More flexible, I guess, and all that stuff. So, what about the reason why amalgam came under the fire, which is it being poisoned? What would you suggest to people? I'm almost sure currently most people will put in that filling anyway, because the price, it's probably a little more, maybe it isn't, but it's not that, it's not out there.
Right.
Yeah. But what about people who have silver fillings in? And they apparently are all right. I mean, the mouth is good. I mean, there's no, if they come loose, they come out anyway, then of course you need to do something. If there's a toothache below it, of course you need to do something. We're not talking about that either. We're talking about people who have a bunch of silver filling in. They got them 20 years ago, 10 years ago, and now there is all this concern. What would you tell to those people?
I don't recommend removing silver fillings just because they have silver fillings in their mouth. If the teeth are in good shape, there's no decay or cavities, then we leave them alone. Plain and simple. We don't simply just remove silver fillings because they're silver fillings. Some dentists will, but I think the jury's still out as far as whether the mercury in the silver fillings is related to any health problems.
Because it only would be if it really leaks, right? Kind of like, right?
Right. Yeah. I mean, if there's leakage, if we're seeing decay or discoloration under the filling, under the tooth next to the filling, then yes, we need to remove the filling because there could be breakdown and we need to reseal the tooth with a new filling.
I see. So the way I hear you is this. The new technology, I mean, it's not so new anymore, but whatever came up over this last decade, and I'm sure it's slightly improving all the time, we just don't hear about it, is simply better. So if you have something to do now, you use the composite filling, you use the white filling, it's beautiful, it's more flexible, it's easier to work for the patient, for the dentist, and that's all there's to it. If an old silver filling is in there, and if it's good, you leave it. If it's bad, well, it needs to be changed anyway. And then, of course, you will change it with a new method, which is the white filling. So basically, a new technology came out, which didn't make necessarily the old technology poisoning as it has been portrayed, or at least not in all cases.
Yes, in my opinion, yes, absolutely.
Well, you're the doc. Well, what else do us patients have to go for than your opinion?
Well, I mean, you can find literature stating both points of view, and they can provide compelling evidence on both points of view. So we just have to go with historical evidence. And I have silver fillings in my mouth, and again, they've been there since I'm a teenager. And I won't say how long they've been in my mouth for, but long enough, and they're okay. There's no problems. My dad placed them, so that's probably another reason why I haven't replaced them.
Yeah, of course. Well, obviously that's a heck of a testimony for leaving your old silver fillings in if there's nothing bad wrong. If it ain't broken, don't fix it, right?
That's right. Exactly.
Good. I love it. I love it very much. I love it very much. Thank you very much.
Oh, sure.